Good evening, beautiful people, and welcome back to another episode of the Deep Culture Podcast. This is Fali once again, and I hope all of you guys at home are doing well. And thank you again for streaming in and joining us on this podcast. Your support means everything to us, and we really do appreciate it. We hope all of you guys are safe at home as well, as circuit breaker here in Singapore comes, or rather, phase 1 comes to an end, and we're hoping phase 2 will come in soon. So please stay safe, everyone, and do your part. And speaking of that, that's going to be also related to today's topic that we have in mind, because we're going to be taking a peek into the lives of healthcare professionals, right? So I have a friend of mine who will be joining us, and she'll be sharing a little bit more about the life of a healthcare professional. But before I touch into that, I just want to make also 2 announcements for the podcast. And the first is that if you guys are following us on the different social media platforms that we have, which is Facebook, Instagram, and YouTube, you guys also will notice that right now we're also releasing the burst clips out there for you guys, which is basically bite-sized clips of the whole podcast episode for you to view on the go, right? So the format has been made into the handphone vertical format, so you guys can go and check it out nicely on the phone. And it's only going to be like at most 3 to 6 minutes long, so that you don't have to listen to the whole episode if you don't have the time to. Of course, we encourage you to watch the whole episode if possible. And the second announcement that I want to make is that following this episode, next week for the 10th episode, it's going to be something different, because next week's episode is going to be me. All right. So next week, I'm getting somebody to interview me so that you guys can have a taste, or rather get to know me a little bit more as the host of this Deep Culture Podcast show. So what I'm going to be doing is that on my Instagram and social media platforms, I'm also going to be asking you guys if you have any questions for me to answer during that episode. So feel free to drop me a DM or put it on my Instagram stories, or contact me on Facebook and let me know what are some of the questions that you guys want me to answer about myself or about this podcast. And I hope to answer that in that 10th episode as well. All right. Okay, so with that done, let's go now hit into today's episode. As I mentioned, today we're going to be looking into the lives of healthcare professionals. And I find this extremely interesting and relevant because of the current situation of the whole world with the COVID-19. So I have a friend, a very special friend of mine. Her name is Ahtherai. Right? She corrected me about her name recently, and I had to drill myself to get it right. Her name is Ahtherai. She's been a nurse for the last 4 years, and she's going to be sharing with us about what she's seen developed in the course of her 4 years as a nurse, and especially during this period as well. So without further ado, please join me in welcoming Ahtherai to the Deep Culture Podcast. Ahtherai, welcome to the Deep Culture Podcast.
Yep. Hi, Sally.
Hello.
Hi, everyone. Yep.
How are you, Ahtherai?
I'm great.
Yeah?
Yeah.
I'm so sorry. I think I still messed up your name, but
No
I'm doing my
worries, no
best.
It's okay. Yeah, you're doing a great job.
Thank you. So how
Yeah.
have you been?
Oh, I've been great. Yeah, running the nurse's life. Yeah, it's been fun.
How has it been so far? Like, right now, are you directly involved with the whole COVID thing?
No, I'm not directly involved, but I do come in contact with certain suspected cases, or at times even positive cases, but not as common because I don't work in a pandemic ward where COVID patients are nursed. But sometimes when I'm deployed to other wards, I do come into contact with positive COVID patients and suspected COVID patients.
Right.
Yeah. Mhm.
And as a nurse, is it scary though? Like when you notice that, these are potential COVID-19 patients?
No, definitely not, because we have also nursed other patients with other infectious diseases, and this is also something similar to that. So
Right.
it's I would say it's an experience similar to that, where we just have to take extra precaution. But no, I don't feel extra scared nursing such patients. No. Yeah.
Wow. So, for me, that's super brave. Like, I mean, even now, if it's just on the public transport and somebody's coughing, even I'm like thinking to myself, oh no, is this somebody who has the COVID-19
Mm-hmm.
infectious disease, right? But
Yeah.
for you to say as a nurse, like, this is just something normal, and we just have to deal with it. Mad respect to you, Adre.
Thank you. Thank you. Thank you,
You're welcome.
Thirdly. Yeah.
Yeah. Okay, so let's start things off firstly with how did you end up becoming a nurse? Like, I don't recall anything back then, since we were primary school friends, that indicated you were interested in becoming a healthcare nurse. So
Mm-hmm.
what was it that brought you into nursing?
Okay. So so honestly, when I was growing up, I wanted to follow the footsteps of my parents who were teachers. I wanted to become a teacher as well.
Mm-hmm.
But I would say my goals in terms of what career I wanted to pursue changed over the course of my studying life.
Okay.
For instance, always have liked helping people and being able to make a difference in people's lives.
Mm-hmm.
Um, in secondary school, I was also in the St. John's Ambulance Brigade CCA,
Oh.
where you usually provide first aid to your fellow students in school, in like events such as the cross country and stuff. So this kind of provided uh, gave me a peek into how nursing mm, would be like,
Right.
because you had the opportunity to like take care of students when they get injured during
Mm-hmm.
sporting events and stuff. Additionally, as I grew older, my mother
Mm-hmm.
also wanted me to pursue nursing, and
Oh, okay.
she felt that she advised me, saying that it's actually a job that will always be in demand, which I felt that was true, because how do I put this? No matter where you go, which country you go to, nursing will always be in demand. Yeah.
Mm,
And yeah, so I kind of like the idea that, uh, it'll be easy
yeah.
for me to find a job and stuff. And beyond that, I would be able to learn how to care for people, not just public, but people in my own family when they fall sick.
Mm,
So I thought,
mm,
that was an additional skill that I could learn. So hence, nursing came about, and I considered it as an option when I uh, had to pursue my studies in
mm.
the university. Yeah. Hmm.
Oh, so it was only in university that you took it up.
Yes, that's right.
Okay. How long was that? And so it's a nursing degree? Is that what they call it?
Yes, it's a bachelor's of science nursing degree.
Mm. And what's
Mm.
your major in that? Or is that the major itself?
That's the major itself. Yeah.
Okay. So
Yeah.
after you went for the degree in nursing, and then you
Hmm.
had, I'm assuming you had attachments and all that, right?
Hmm.
So you were straight away attached to NUH all the way?
Yeah, because I had signed a scholarship when I was studying with NUH,
Ah,
and hence, right after I finished studying, um, yep, I went to NUH to, serve the patients there.
right, right.
Yeah, yeah. So that's also another, added advantage. Once you don't have to like try hard to find a job.
Mm,
Like, once you finish studying, as it's always a job in demand,
mm-hmm.
it's easy for us to find a job.
Yeah.
Yeah.
I mean, that's one way to look at it, but also like I've heard cases. I mean, I don't know about nursing, but I've heard cases, for
Yeah.
example, where like teachers have to sign a board with NIE, right?
Mm,
And then
that's right. Yeah.
they end up midway through, like they don't quite enjoy teaching. So there's also a
Mm-hmm.
certain risk that you may not end up enjoying this profession that you're bonded with. But for your case, you actually
Yes.
enjoy nursing. Am I right?
Yes, you're right, Fadli. You're completely right. I've got friends who didn't really, enjoy the nursing profession, and
Mm,
who also had like signed scholarship bonds,
right.
and they dropped out of nursing to find something they like better in life.
Mm.
Yeah.
So, but for you, you enjoy nursing. So what is
Yeah.
that down to, though? I know you had a good taste of it like during your secondary school CCA days, but
Yeah.
what is
Yeah.
it really about nursing that really makes you feel like this is something you enjoy doing?
Mhm. Okay, so during my studying years, I still doubted myself.
Mm,
Is this really what I wanted to do? But after I started work, and when I had the chance of being there for people in their most vulnerable states,
mm-hmm.
when they're sick, because in Singapore, most people in the family always go to work,
Right.
yeah, and they're not always there for the patients in the hospitals, but as a nurse, you can always be there for the patient, and it's something I would say is a gift.
Mm-hmm.
That we have, that you can provide emotional support to the patient, and be there for someone who doesn't have their closest ones near to them. So you're like so-called a pseudo family to them when their
Mm-hmm.
actual family is not around. So I
Right.
found that good. Yeah, and apart from that, my grandmother was down with stroke at a
Okay.
certain period in her life when she grew older. So
Mm-hmm.
then I was glad that what I learned in nursing was actually useful in me being able to care for her.
Oh, that's nice.
Yeah. So I felt good that uh, I can apply what I learned to care for my grandmother and not rely on others to care for her.
Mm.
Yeah, so that really made me feel good, because she looked after me when I was younger, and I was happy that when she was older I could actually give back to her in a way.
Mm.
Yeah.
Definitely.
Yeah.
Cool. Okay.
Mm,
So since the last, how long has it been? 4 years. It's been 4 years you've been in nursing, right?
yeah.
How would you sum up those 4 years so far?
Well, well, I would say it's been really sort of like a mm, like beginning years I used to like end work late because uh I still was learning, how to go about doing things, managing my time. But
Yeah.
over time, as I got used to like work and you know, um, managing my time and like getting my work done within that time, I managed to end earlier.
Mm.
And uh, there are days where patients throw tantrums at you because when they're sick, they're not in the best of their moods.
Yeah.
But you will eventually grow to understand why is a patient behaving this way. And we have unappreciative patients, but on of course on the other hand we have appreciative patients as well. So
Yeah.
when your patients are not very appreciative, sometimes it would like make you question why am I in this profession where what I do isn't being
Appreciate it.
appreciated, I'm not being recognized for what I do. But yeah, but at the end of the day, you do something because you want to make a difference, not because you want people to recognize what you do,
Mm-hmm.
because it makes you feel good, but not because you want others to like praise you, like, oh wow, this girl is doing something good. And not
Yeah.
not for that kind of reason. So such things made me going. Yeah. And I mean kept me going. And I made a lot of friends. I could meet a lot of people from different walks of their lives.
Yeah. Yeah. Definitely.
Yeah. And like I said, when I wanted to be a teacher in my younger days, actually nursing allowed me to do it. I learned how to do research as well back in school.
Okay.
So
Mm-hmm.
as a nurse, I could, not just nurse my patients, but I could, wear different hats. I could teach my
Mm.
juniors, how to carry out certain nursing skills, um, conduct research on how to better nursing practices.
Mm-hmm.
Um, yeah, and one of the I also had an opportunity to go overseas,
Oh.
to volunteer in India to make health assessments and provide nursing care to this less fortunate
Mm-hmm.
society, particular group of people in India. So yeah, I guess that was something nice
When was
that
that?
nursing gave me. Oh, it was back in last year, May 2019.
Okay, that's
Yeah.
cool. So you
Yeah.
were sent on behalf of your hospital to do a project like that, or?
Oh no, no, no! I just met this lady
Mm-hmm.
through one of our community events in Singapore, uh, and this lady was organizing like a volunteer mission in
Mm-hmm.
India. So I got to know her, and then she was like, "Hey, you know what? Would you like to join me on this mission where we could go and serve the less
Mm.
fortunate people in India?" And we brought some medications over to them, and like did health assessments on them. People who don't have easy healthcare access.
Yeah.
Yeah, so we did assessments on them. Then we provided um, medications to them according to their healthcare needs. For instance, if they have cough or like
Mm.
fever, or like some patients they did. I mean, some some of the people, they didn't know they had like things like diabetes or high blood pressure. Then we identify these things for them, and we partnered with like the hospitals in India, and we referred these people to the hospitals there to go and seek further medical treatment for their this certain conditions, because they're not very medically literate as well.
Right.
Yeah,
Okay.
so yeah,
So that's the kind
this
of
it
assistance
was
that
good.
you brought.
Yes.
Okay. Oh, that's cool. I didn't know you went to India at all.
Yes,
Like
I
even
went
on
to India
Facebook while
last.
I was doing research on you, I was like, huh, no, I don't see anything.
Yeah.
Okay. So going back to nursing though, what's it like for a day-to-day activity for a nurse? Like we know
Okay, so
that nursing as a profession, like
mm,
is to just is to take care of the patients there. But what's it
yeah.
like for a day-to-day activity for a nurse?
Okay, so we start off the day with serving medications for our patients.
Okay.
I mean, that's if you do morning shift. Yeah, so roughly, uh, nurses in the the acute hospitals, we serve medications
Mhm.
to our patients. We of course take care of their hygiene needs,
Right.
like showering them, changing their diapers for patients who wear them, preparing
Okay.
them for surgery or procedures. Yeah, and making sure they're always in safe hands.
Mm.
Yeah, like we make sure sometimes even doctors' orders, it might not always be correct. So sometimes we're the last line of defense of making sure the order is correct. Because sometimes the junior doctors, they might not know what they order, or they might order something wrongly. So
Mm.
as an experienced nurse, you're able to identify that and highlight to the doctor, is this really what you want to order? Because I think usually it's ordered in this way, or this particular route is not correct. Sometimes they might overlook. So as a nurse, you're able to as an experienced nurse at least, you're able
Mm.
to identify such errors and highlight it to the doctor and make sure your patient receives the best care, not nothing goes wrong as
Right.
much as possible. Yeah. And we also play a part in allaying families concerns and anxiety. Like they'll be like scared of their
Mm.
loved one when they are sick. Yeah, so we provide as much reassurance to them as possible.
Mm.
And of course, like in events that's inevitable, patients pass on and stuff, we provide emotional support to families when they need
Yeah.
it most. Yeah. So yeah, so serving medication, taking care of patients' hygiene needs, and being emotionally there for the patient and the patient's family. And of course, we collaborate with the uh, how to say medical team, the physiotherapy, speech therapists,
Oh,
doctors.
okay. Mm-hmm. Mm-hmm.
Yeah, so we'll discuss together with them and see what is the best treatment that we can provide for the patient. Is this like is this the best care that we can provide? What other services are there when the patient discharges back home, when the patient goes to the community? We make sure that they're discharged safely, make sure there's someone who's well equipped to care for them.
Mm.
Yeah, for instance, like elderly patients who live alone,
Right.
we yeah who have problems, who maybe they have a decline in like function in terms of having difficulty walking to like the shops to get their meals. So we partner with the social workers to make sure they have this service called the Meals on Wheels, where
Nice.
volunteers come home to deliver meals for them and stuff.
Right.
Yep. Yeah, so yeah, so from the time they come to the hospital till the time they get discharged back home, we make sure they're well cared for.
Yeah.
Yeah. Yeah.
So that's basically nursing in a nutshell.
Yeah, so cool. And of course, there are nurses in the community as well,
Mm.
who go to the patients' houses and make sure the patients are coping well. Yeah,
Mm.
they go to the patients' houses to give them to do wound dressings for them.
Right.
Yeah. So what I the summary I gave you was mainly what nurses do in hospitals, but there's more to it. The nurses who work in the community to like help
Uh,
patients there as well. Yeah.
Gotcha. So is basically every day a different routine for you, or is it like do you find like after a while nursing is just this, it's just a normal routine where every day is going to be doing the same old things and becomes repetitive?
Mm. Okay, so the routine is the same,
Okay.
but definitely on a daily basis we meet different kind of patients.
All
Like
right.
patients who are easy to handle and patients who are hard to handle.
Mm.
And sometimes we come across new procedures with new technology.
Mm-hmm.
Yeah, so there's always things to learn, and like
So you need to upgrade
sometimes we get.
yourself with the new skills and all that, is it?
Yes, definitely. Always, education is always like an ongoing thing for us, where
Mm.
we have to update ourselves with the latest technology or the latest best practices
Mm-hmm.
that are there.
Mm-hmm.
And we
Right.
also do research as nurses who are trained in research.
Mm-hmm.
We sometimes do conduct research to see what are the best uh,
Oh,
practices on ground that we can bring about that will provide the best services or care to the patient.
right.
Yeah. Oh, when we get deployed to other areas
Mm-hmm.
in the ward, then we learn new things.
Mm. So there's different departments where there's
Yeah.
different
Like for
routines
instance,
and.
I work. Yes, different departments. Yeah.
Mm.
Yes. Yes. Yeah.
So sorry, you were
Yeah.
saying?
For instance, I work in the renal ward where we deal with dialysis patients.
Mm-hmm.
But recently I got deployed to the intensive care unit,
Mm.
um, where I was under the this initiative by the hospital, where nurses get retrained or like trained further for like managing patients
Mm-hmm.
in the ICU in case there's a second wave of COVID. Then the nurses are well equipped to like manage the patient
Situation.
load. Yeah, yeah. So it's to supplement the nurses in the ICU in case the, the the beds there are like fully occupied and the nurses they are
Mm.
overwhelmed. Yeah, so the general ward nurses will go to the ICU to help them with
I see.
the care there. Yeah. So we constantly keep learning, keep upgrading ourselves and exposing ourselves to new skills. So
Mm.
the routine is there, but definitely you learn new things.
Mm.
Yeah, every day.
That's so cool.
Yeah.
Mm. So apart from the day-to-day activities that you mentioned, right, Adire,
Mm. Yeah.
um, are there certain things that are not commonly seen from the public eye that that nurses play a vital role in the healthcare services? So are there certain things maybe that you can share with us?
Okay. So some of the one of the roles that nurses play, one of the vital roles is that
Mm-hmm.
uh, they are one of being always at the patient's bedside. They are one of the first medical personnel to detect patient deterioration, which means, when a patient's
Mm.
blood pressure plunges suddenly, they're one of the
Right.
first ones to detect. So, they play a vital role in detecting that, what, the patient is sick and I need to inform the doctor. So, early escalation by the nurses will actually mean life or death.
Right.
Yep. Yeah. So, um, they basically in a nutshell
Mm-hmm.
save people's lives. So if the nurse doesn't detect on time that the patient's condition is deteriorating,
Mm-hmm.
they may not be able to save the medical team will not be able to save the patient on time.
Right.
Yeah, but if the nurse is always on the alert,
Mm-hmm.
which of course we always are, yeah, is always on the alert and detects the patient deterioration early, then we escalate it to the doctors and start performing the CPR before the doctors come.
Right.
Yeah.
So
So
you
as soon as
guys,
CPR is commenced, yeah, then it also means that there's higher chances of patient survival.
yeah,
Yeah.
definitely. So that means that you guys have, like, okay. So, but wait, before I ask that question, how long roughly is your shift like?
We work different shift hours, but it ranges from 8 to 12 hour shifts.
8 to
So
12
morning and
hours.
afternoon shifts are usually 8 hours, and night shifts are usually 12 hours.
Wow. So within the 8 to 12 hour kind of shifts, you guys have to be constantly on your toes, if that's the case, right?
Yes, definitely.
Wow, that's long hours to be like
Yeah.
always on the not on the edge, on your toes.
Yeah. So apart from detecting patient deterioration and saving lives,
Mm-hmm.
nurses also, when patients pass on, they also ensure that the patients pass on as comfortably and as painlessly as possible. Yeah,
Mm.
by serving them the necessary medications that will help ease their breathing and help promote comfort um, when they have pain when they're passing on.
Right,
Yeah.
right.
So yeah. So in
So even
summary, like mhm.
that even falls under the roles or responsibilities of a nurse as well.
Yes, yeah.
Oh, okay.
So
Yeah.
yeah, So as nurses, we bring, um, we how do I put it? we are one of the first people that babies meet when they are born, and when people pass on, we are one of the last ones to send people comfortably
Mm,
off. Yeah,
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 that's true. I never really thought of it that way though.
yeah. So
Mm,
one of the challenge you also asking me, what are the challenges that nurses face?
mm,
Yeah, so apart from on-ground challenges, sometimes we also face difficulties such as not being able to be there with our families during special occasions, on public
mm.
holidays. Yeah, so these are some of the sacrifices that nurses have to make.
And all for the noble cause, right? So,
Yes, definitely.
yeah, it's really great what you're doing, Adri. So I really respect you for that.
Thank you for being so nice.
Okay, so mm, since every day is a different day in a way, right? Every day is
Mm-hmm.
a different experience, I would say.
Yes.
What do you think is the greatest kind of like skill that you need as a nurse in your 4 years of
Hmm.
experience so far? Like, what's the is um I don't think it's a skill, but what's your
Mm-hmm.
you get
Quality.
yeah your greatest
Yeah.
quality you need as a nurse? Is it patience to handle
Mm-hmm.
like you said, the families and the moods of the patients,
Yeah.
or is it empathy? I don't know.
Mm-hmm.
What would you say is
Mm.
yours?
I would say three things,
Mm-hmm.
uh, which is patience, tolerance,
Okay.
and selflessness.
Hmm. Patience and
Yeah.
tolerance, are those two of the same things?
No, patience would be um, being patient enough to listen to your patients, patient enough to listen to your patients. um, like,
I see what
yeah,
you did there.
patience, yeah, patience, like uh, requests, and tolerance is, being able to, um, sometimes nurses, uh, not everyone has the tolerance to, stand patients who are over demanding.
Mm-hmm.
Yeah, sometimes they might easily snap at people.
Yeah, yeah.
Yeah, so being in the service sector is very important that you have tolerance towards patients who have a not very nice attitude, patients who
Mm,
are overly demanding, uh,
right.
yeah, patients' family who like don't understand why certain things are carried out in a certain way. For
Mm,
instance, like sometimes we might take time to attend to patients, and the patients' families might not see eye to eye with that.
yep.
They might see like, hey, how come the nurses are taking time to attend to my loved one? Yeah, so in such times we need to like exercise tolerance in the fact that because they're not in our shoes, and because their loved one is in a vulnerable state, it's hard for them to understand
Yeah.
what actually is going on because you're not on ground.
Yep. Yep.
Yeah, so then we have to be patient then
Mm,
and tolerant towards their behavior and attitude, and like explain to them, and apologize to them, like sorry for taking time, I'll try my best to
mm,
attend to your loved one as soon
yep.
as I can. Yeah, so yeah, you just have to try and make them understand, not expect them to fully understand
Yeah.
why you were busy. Yeah,
When you were elaborating on that, I couldn't help but think about the experience I always have when I'm visiting my grandfather at the hospital. And I know
yeah,
there's always the situation about visiting hours and how many visitors can actually visit him in the wards. I think it's only
that's right.
four, right?
Yeah,
Four visitors.
actually, yeah, so when COVID was going on,
Mm-hmm.
like now only one visitor is allowed.
Oh, okay.
Yes, allowed. Now, I think in my hospital, like, four visitors can be registered, but even to visit the patient in the ward, only one
One.
visitor is allowed in person. Then you take turns to like visit. Yes.
Right.
Yeah. So yeah, good example that you quoted. So families will be like quite frustrated. Why
Mm,
why must it be like this? Yeah. So we have to take time to explain to them,
yeah.
and like negotiate with them that
Mm-hmm.
yeah, it's for the best of our patients, to make sure we don't expose them to potential infections.
Yeah.
Yeah.
And also resting time, like I know
Yes,
8 p.m. or something,
definitely.
right?
Yeah. Yes, 8 p.m. is a cutoff.
Yeah, and then we'll try ways to
You're
kind
right.
of sneak in
Yeah.
after 8 p.m. and stuff like that. Yeah, I get you.
Yeah. Yeah.
Mm.
Yeah. And
Uh,
one more other quality, very important quality, is to always smile. Even if
mm,
you're angry, even if you're hungry, no matter in which mood are you in, is to always wear a smile and like,
mm,
provide, you know, it kind of will always lighten your patient's mood
mhm.
and the patient's family's mood. Yeah. So it's just smile.
So you've mastered
Yeah.
the art of smiling now, right?
I think so. Yeah.
Yeah, I think it's always important, especially in the service industry, to manage a smile.
Yes.
Yeah. So, okay, so one of the reasons why I asked you this was because also, as I mentioned in your introduction, is that you also received the Nightingale Award.
Yeah.
So, you
Yes.
want to elaborate about what that award actually means? Or,
Okay.
Mhm,
Yeah. So back last year, in May, yeah. So a group of nurses from my hospital and UH, we were selected by our management to be recognized with this award, the Nightingale Award,
mhm,
where nurses who have contributed significantly
right.
to the ward, the hospital, and given commendable care to their patients, to so called like cheer them on and to like um say thank you for your service to the hospital. Yeah.
Mhm,
This award was given. Yeah, so I was one of the recipients of the award. Yeah.
okay.
But as I always, what I felt that was that even though I was recognized for the award, deep down I felt that this the award was actually a dedication to all nurses, not just me, for
Mm,
for the the amount of like sacrifices they go through to
yeah,
be a nurse, and the amount of effort they take to put others before themselves
yeah.
every day in the nursing profession. Yeah.
And
So
nursing,
yeah,
am I
I
right to say
feel
it's a
that all
team
nurses should
effort?
get it.
Sorry.
Yes, definitely. No worries. Yeah, so definitely it is a team effort.
Mm,
Um, because in the ward, like it's not just one nurse caring for one patient. We have a group of nurses caring for
mm,
that patient. We work as a team. When our nurse colleague is busy, we make sure we help them out. Or if
mhm,
I'm busy, my colleagues make sure they help us out. So it's not just one nurse who is caring for that particular patient
mm,
throughout her entire shift. It's a group of nurses. We take turns. We work as a team. Yeah. So it's definitely a team effort.
mm. What you're saying is everybody in your team also deserves that award.
Yes.
Yeah,
All
that's nice.
nurses
All nurses,
in the
all
world
nurses.
deserve the
Yeah,
award.
yeah.
Yeah.
Congratulations, by the way, on that.
Thank you. Thank you.
So yes, so as you just touched on, all nurses in the world deserves the award. Now, we, while we're talking about that, let's talk about also the newfound appreciation. It seems like the newfound appreciation for healthcare professionals during this COVID-19 situation. Like I've
Yeah.
noticed recently, like now suddenly, there's the attempts for SG United at 8 p.m. We clap for the healthcare workers on the
Mm-hmm.
front lines and all that. So there
Mm-hmm.
is that seems to be a newfound appreciation for them.
Mm-hmm.
What do you make of it as a nurse? What's your opinion about it?
Mm, yeah. So I mean, I feel appreciated, and I'm happy that during this not very how to say, this trying period of time for the world, that
Yeah.
yeah, that that Singaporeans have come forward, and of course people across the world have come forward to recognize the efforts that healthcare professionals have taken to care for others. Yeah, I mean, I'm deeply happy and grateful. I just hope that uh, this actually doesn't end here, and
Okay.
it's always like a constant um, thing that people do for healthcare professionals.
Hmm.
Not just in the bad times, but also in like always every day in good times as well.
Hmm.
Yeah.
So when you mentioned that, is that to say that before this, nursing hasn't always been mentioned in a respectable manner? Like You're trying to say before this, nursing wasn't given the respect that it was due.
Uh, Not really. There was always I okay, it's quite a tricky question.
Mm.
Um, I don't know. I think in Singapore,
Mm-hmm.
like the nursing scene, uh, it's people are slowly starting. Before even COVID happened,
Right.
there were initiatives like the Care to Go Beyond, where nurses are,
Mm.
appreciated. Their work is brought to light, um, and there were dramas in like certain channels like Channel 8.
Yeah.
The Do You Want to Be an Angel 2 drama, and like
Mm.
stuff like that. Which actually showcased the day-to-day activities that nurses carry out, the sacrifices they go through and stuff. But
Mm-hmm.
there's a group of people who appreciate nurses, and of course there's some others who don't. Yeah, so I hope like people will um, change their mindsets of nursing, and uh, appreciate nurses for what they do. Yeah,
Mm. So when you
better,
mentioned,
appreciate better.
when you
Yeah.
say change the mindset of nurses,
Mm.
so what is that changed about actually? What do you think was the
Yeah, so
previous mindset like?
mm, some people who are not in the profession, or who don't have people whom they know in the profession, they just the
Mm.
first thing they think about when they think about nursing is that, oh, nursing is just people tending to the hygiene needs of patients, such as changing diapers,
Right.
doing the dirty job. But
Mm-hmm.
that's not just all that there is to nursing. There's more to it,
Right.
whereby when we change diapers, we actually look at the patient's skin, we assess the patient's skin, make sure they don't have any wounds, and if there are skin breakdown, their wounds, we actually assess the wound,
Mm.
think about what wound product actually will suit the wound,
Right.
and dress the wound appropriately, because nurses are better trained in such
Mm.
areas of the medical field more than doctors. Yeah. Of course, doctors give their suggestions as well, but dealing with actual wounds, nurses are like, some experienced nurses are more better, well versed in such things.
Right.
So it's not just about changing diapers, it's also doing skin assessment, dressing wounds, being there emotionally, and
Giving the right medicine as well.
morally, yeah, there for your patients in their most vulnerable
Mm.
periods of their lives. Yeah.
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 So since you touched on that as well, you mentioned doctors. I mean, since we're talking about appreciation, I know that,
Mm-hmm.
and correct me if I'm wrong, but it
Mm-hmm.
feels to me, at least from an outsider's point of view, that
Mm-hmm.
doctors are seen as a more respected profession as compared
Mm-hmm.
to when somebody mentions the profession of a nurse, right? It seems
Yeah.
like there's a
Mm-hmm.
divide between the doctor and a nurse. So,
Mm-hmm.
like, how about from a nurse's point of view? How do you feel about that?
Yeah, it's true. Even patients sometimes in the hospitals, they
Uh-huh.
listen more to the doctors than the nurses.
Oh, okay. Mm-hmm.
Yeah, like we would say the same thing, but
Uh-huh.
they would only be willing to listen to the doctor. Yeah,
Mm,
and they'll be like, know what? Sometimes they'll say, know what you're saying. I'm not ready to listen to you. Just call the doctor.
mm,
We shall see what the doctor says.
okay.
Yeah, yeah. So it is true that at times doctors are respected more than nurses, but good medical care comes about when doctors and nurses work as a team.
Right.
Yeah, and yeah, I mean, doctors come up with the best treatment plans for the patients. As much as they do that, nurses are always there for the patient at the bedside. When
Mm,
the patient's sick, when the
right.
patient is vomiting, yeah, and when the patient is down, to morally sit with them and like console them,
Yeah.
yeah, and to cheer them on. That uncle, you can get through this. Don't be sad.
Yeah.
Everything will be fine. Yeah. So we have the extra time to sit with them and like be there for them as a
Mm,
friend, as family. Yeah. So coming back to your question, that there are people who respect doctors more than nurses.
mm-hmm,
Yeah, and I hope one day uh this will change. Like
mm.
more people will see both the medical profession and the nursing profession on the same standing.
Right.
Yeah.
So what is it gonna take, do you think, for that to happen?
Mm,
Do you
I
think that with this
suppose.
whole COVID-19 situation,
Yeah.
that people also
Mhm.
respect the fact that it's not just doctors who are on the front line, but nurses are also on the front line?
Uh, yes, yes, of course.
Mm-hmm.
Yeah. So, uh, I feel that this medical crisis that the world is experiencing now will definitely, shed light on what an important role nurses also play
Yeah.
in treating patients when they're sick.
Yeah.
And so I guess awareness through, you know living in a technologically savvy world,
Mm-hmm.
awareness through digital platforms, recognition of nurses work, more documentaries on, like, what nurses actually do, with the hardships we go through.
Right.
And it's not just about, uh, like I said just now, not just about tending to patients' hygiene needs. It's more to it.
Right.
Yeah. And nurses carrying themselves professionally is also another,
Mm.
mm,
That's a
you
good
know
point. Yeah.
thing we can do as nurses to, gain respect among the general public. Yeah. And uh, yeah, I guess roughly that's about it.
Yeah,
Yeah.
that's
and,
true.
and now, like, um more roles are coming about in nursing. Like, there's an advanced practice nurse role,
Mm-hmm.
whereby nurses actually are able to prescribe medications for their patients, diagnose patients. Yeah. So I guess more roles are opening up for nurses. Yeah. So things like that public are not really aware of. When they
Mm.
become more aware of it, they'll be like, oh wow, like nurses actually do so much for their patients.
And it's
Yeah.
just as
Then
important
they
as
realize,
the role of a doctor
of a
is.
doctor. Yes,
Yeah.
yes. I mean, one is definitely not better than the other.
Mm.
Both is equally good. That's
Mm.
that's that's what people have to, realize and, yeah, recognize, I would say.
Yeah. So I think it's great that the awareness has come about. I mean, of course, it's not
Mm,
the best situation for it to come about, like with all the
mm,
things, the tragedy going on. But at
mm,
least one of the good things coming out has been the awareness of the respect and the responsibilities of nurses and how well they are doing and how much they are doing for the community, right? Especially right now. So thank you, Ahtherai, for putting your life on the line in that sense. And for the rest
no
of the
problem.
healthcare workers out there as well.
Yeah.
Yeah. Okay, so I think we're gonna wrap up, but I just also want to ask you one last question, if you don't mind sharing.
Yes, yes.
So far,
Mm,
what has been your greatest experience so far as a nurse? Either experience
mm,
or a greatest lesson that you've had while being a nurse.
okay. So, I had mentioned that, that I was able to go on a mission trip overseas
Mm-hmm.
to help the less fortunate there,
Right.
and to provide medical care, to provide medical education to the people there.
Mm-hmm.
So that was one of the, biggest experiences I had, to
Right.
actually appreciate, what better medical facilities we have here compared
Mm.
to, lesser developed countries. And I was, really grateful for the fact that, Singapore is more medically advanced, and there's like more easier medical access to people here.
Right.
Yeah. So, it kind of allows you to appreciate uh, living in Singapore.
Mm-hmm. Yeah.
Knowing that the government is, doing a lot of things to make sure everyone gets easy medical access.
Yeah.
Yeah, that was one great experience.
Mm-hmm.
And and I had the opportunity to meet and to nurse a celebrity during one of my shifts. Yeah, so that was another, good experience I had.
Mm.
Uh, yeah, so I was able to take a picture with the celebrity. Yeah, yeah. So I guess, like, it allows you to come across things that you would have never thought of coming across.
Mm.
Yeah.
Most
And
definitely. Yeah.
meet you know people uh whom you think you'll never meet ever in life.
Mm. Yeah.
Yeah. So yeah. And as nurses, there are nurses who actually go for like medical missions overseas during like earthquakes or like natural disasters. Yeah, so it's
Tsunami
another
disasters.
another possible opportunity that I might have in the future.
Okay.
I don't know. Yeah. So basically, I don't know. The biggest takeaway that I feel I have from nursing is that to be able for to be able to be there for like people
Mm.
in one of their lowest points in lives. I guess that's something um, that I'm blessed to be able to do and get paid for it.
Right.
That's even better, right? Yeah.
Yeah. When you put it that way, it
Yeah.
sounds amazing. Yeah, yeah.
Yeah.
Yeah. Most people will be like, I have to go to work, I have to do
Mm.
this, I have to do that. But for you, it's like it's a blessing, it's an opportunity for you to make a difference, right?
Yep.
Yeah. Very cool. Very cool. Thank you so much, Adre, for sharing that.
No problem. Pleasure was mine, my dear friend. Yeah.
Thank you. Uh,
Yeah.
yeah. So, anything else you want to add on before we finish this up?
Mm, not okay. Let me think. Mm. No, like I would really like to thank you for having me on your podcast. Yeah.
Oh, you're welcome.
Thank you for thinking that I can contribute. Yeah,
Most
and
definitely.
yeah, like you said, I hope the nursing scene in Singapore is slowly
Mhm.
developing.
Right.
People are slowly starting to change their perception of nursing. More people are joining nursing. More people are doing mid-career switches to
Right.
nursing.
Mhm.
Yeah, and our biggest takeaway is the fact that we can be there for people in the most trying times of their lives, and give, I don't know, give back to society in a way through our
Mhm.
careers,
Yeah.
and yeah, help people as much as
Beautiful.
possible. Yeah.
Yeah. That's
Yeah.
great. That's beautiful, really.
Yeah, so basically, all in all, I hope one day nurses will be equally respected as doctors by
Mm.
everyone in society, not just some of them.
Yeah.
Yeah.
Good point. Thanks, Adre.
Thanks. Thank you, Feli. Thank you.
Yeah. Thank you so much for coming on
Yeah.
and sharing with us, giving us a peek into the life of a healthcare professional. Because I thought it would be important also for this podcast to share and enlighten the streamers and the viewers about what it's like during this tough time, this tough trying
Mm.
time with everything that's going on. So at least
Yep.
like you mentioned, it's about spreading the awareness. It's about having the newfound appreciation, and not just for this small period of time, but for as long as you can go. Because what you guys are doing, putting your lives on the line every day, like you mentioned, COVID-19 is just one of the infectious diseases going on right now. To you
Yep.
guys, it's an everyday thing. You guys are every day gonna be, you guys are there every day in the vicinity of infectious diseases, but we don't see that, and therefore the appreciation is not quite there. But I
Mm.
hope this spreads light. I hope people get to see that, and I hope like appreciation continues to grow from here. So thank you so much for coming on and for sharing that, Adre.
Thank you so much, Feli. Thank you.
Yeah.
Yeah.
All right. So with that, I think that about wraps up today's episode. Thank you so much for coming on again, Adre. Thank you so much, streamers and viewers, for staying tuned and enjoying this episode of the podcast. Don't forget to like us on Facebook and YouTube. Subscribe to us on YouTube. Follow us on Spotify. And also, if you guys have time, go and check out the burst clips on our respectable social media platforms for you guys to have on the go. So with that, I think that about wraps up today's episode. Thank you again, Adre. And I'll see you guys on the next episode of the Deep Culture Podcast. Bye.